Hey there, I'm Monika Buerger, and we're in for some great information coming your way on if you want to get the lips, you got to get the hips. So, what the heck does that mean? We're going to talk about postural stability and oral fascial restrictions and the suck, swallow, breathe reflex, and a whole bunch of fun stuff. Ready, set, here we go. Here's the scoop. In order to get good postural stability and good head posture for good oral swallowing and airway, our suck, swallow, breathe reflex, it actually starts from the bottom up. So, our suck, swallow, breathe reflex is an infantile reflex, and it should integrate, it should be gone. It's got a wide range actually for between 6 months and 18 months. So it's a broad span in there. But what you're going to look for, this is something I get questions asked about quite a lot. A, why is little fiddle fart not sitting independently? What's going on? And sometimes they will actually be meeting other milestones like creeping, crawling on all fours, rolling, and even wanting to stand, but they can't sit independently. That's a telltale sign that there is potential neuro-dysregulation and neuromechanical restrictions that might be interfering with that motor ability. And we're going to talk about that. So that suck swallow reflex is there in infancy. By latest of 18 months, we want it to be gone. But if it's not, we might see that infant toddler not having food aversions, okay? Because it can be scary to eat, chew, swallow if you don't have good airway capacity. So here's how it rolls. About 5 to 6 months of age, this is a key milestone that we want to be mindful of and be watching for during our neuromotor development trajectory. 5 to 6 months of age, they should be bringing their toes to their nose, right? They're grabbing both feet and coming up in that flex position. And then they start to go to a cross lateral pattern, right? Maybe left toe with right arm, right toe with left arm. And we start to build the pelvic floor at that time. So two key muscles that are coming into play here are transverse abdominal muscles and our psoas muscles. Here's the scoop. Here's where we start mingling everything together. Psoas is referred to as the seat of the soul. It is incredibly important for postural stability in the upright position, but here's the catch. The psoas is actually very important for sitting stability, for postural stability in the seated position. And that needs to come on board in order to get good core control while we're sitting, good core postural control, and good head control. And the head should be over the shoulders and over the pelvis in order to have good airway. And that's where things can go cattywampus for those kiddos that don't have that good postural stability. And then you might see eating aversions. So 5 to 6 months of age, toes to the nose, then the cross lateral pattern. It's developing the transverse abdominis and the psoas muscles. The psoas muscles come in and tie in to the inferior portion of the diaphragm. So that's how we can get some tethering. If we've got either too lax or too tight muscle bundles on those psoas muscles, the insertion into the inferior portion of the diaphragm can start to lead to lack of diaphragmatic movement. And that can lead to difficulty of that suck, swallow, breathe reflex to dissipate and not be active anymore. And it can also lead to, with lack of diaphragmatic movement, we can get aberrant vagal tone. And the vagus nerve is a huge neuromodulator and that suck, swallow, breathe reflex. So hopefully you're seeing all the ties here, how it all ties together. And the floor of the mouth, the tissues on the floor of the mouth insert into the superior part of the diaphragm. So we end up with this piston effect between the pelvic floor and the floor of the mouth. So if we have oral restrictions, tongue ties is a big thing that's been talked about. I've been working in that realm for 15, 20 years-ish, but it's a big splash in these last 5 years or so. So if you have this fascial restriction and this piston effect between the pelvic floor and the floor of the mouth, both causing stress on the diaphragm, can now stop moving in a good breathing pattern that we need it to and act as a core stabilizer because the lack of stabilization from the pelvic floor. So the whole sequelae ends up being fascial tension from the pelvis to the cranium, tension on the diaphragm, lack of diaphragmatic movement, which can potentially lead to aberrant vagal tone, which modulates the suck, swallow, breathe reflex, which can lead to stress, anxiety, complications, difficulty chewing and swallowing, and lead to food aversions. There's a lot to unpack there, and it all trickles down, not all of it, but a lot of it trickles down to lack of neuromotor patterns established in the early months, that 5 to 6 months, with the toes to the nose to promote that core stability. And again, the psoas muscles are incredibly huge in this whole paradigm we have here. And then later on, what you can see are those kiddos not only are they not sitting independently. Again, that suck swallow reflex integrates between 6 and 18 months-ish. And that's when we start to see 6 to 8 months is when you start to see the little fiddle farts sitting independently, if they have that good postural stability. So taking the whole picture into context, we want to start making sure we take a keen eye at 5 to 6 months of age so that the train doesn't derail later on down the road. And other abnormal motor patterns you might see is the inability to get on all fours and rock because of lack of core stability, lack of 4-point crawling, cross crawl pattern, and maybe what we call postural instability or postural insecurity, and they don't want to be upright against gravity. And that can all lead from those early aberrant, abnormal motor movement patterns. So when you get a kiddo that's not sitting independently or not good core control, where they can actually pivot and move off the center of their axis by 8 months of age, and they're not doing well on transitioning to eating independently, I want you to think postural instability. I want you to look at the pelvic floor. I want you to look at vertebral subluxations and the lumbars, the pelvis. Look at the psoas. You might need to do a psoas release if there's some psoas restriction in there. And of course, don't negate the rest of the spine, the cranium, and the floor of the mouth. Okay, so I know that was a lot to unpack, but here's the scoop. If you really want to learn and master this information, scroll down right now, scroll down, join our 6 pillars of Foundations of Neurodevelopment certification course. 6 pillars. It gives you all the information you need to learn, master, and be able to identify the train before it derails. So I'll see you on the inside of that amazing program.